On the benefits of non-aggressive exercise, I wanted to make a video about how exercise should not be punishing. A lot of people are getting into this nonsense about how, exercise needs to be, super manly, and by manly I mean very ridiculously you must ridiculously overexert yourself. You must seek to do damage to yourself in some way. But what people don't understand, if you're hurting yourself, you're not going to be making progress. And for the purpose of the retention of health, really ridiculously aggressive exercise is not necessary. However, consistent exercise is. So I'm going to start by going over a couple things with walking, stretching, strengthening, and breathing exercises. Walking is a form of cardiovascular exercise that also helps with balance and such. But let's go. Okay, so this is walking for fitness. Recent studies have linked regular physical activity with reduced likelihood of developing coronary heart disease. Even low and moderate intensity exercise such as walking, when carried out consistently, keep that in mind, low and moderate intensity exercise when carried out consistently is associated with important cardiovascular health benefits. Regular walking may help improve cholesterol profile, help control hypertension, and slow the process of osteoporosis. Recent physiological studies have demonstrated that brisk walking provides strenuous enough exercise for cardiovascular training in most adults. A recently developed submaximal 1-mile walk test provides a simple and accurate means for estimating aerobic capacity and guiding exercise prescription. These new insights and tools will assist the clinician in the prescription of safe and effective walking programs. Now, to be honest, the form of cardiovascular exercise that I do is a little bit more intense than just regular walking. It's like a ski. It's a hybrid between a ski machine and an elliptical, and I do that for about an hour a day. I either do it in 3 20-minute sessions, or I break it up in some way. Sometimes I'll just do an hour straight, but that's how I do it, which is a little bit more aggressive than walking. But walking is pretty much all the average person needs to promote health. Okay. Abstract. Okay. There is clear evidence that physical activity, including walking, has substantial benefits for health. This article, prepared as part of the proceedings, blah, 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 results. Walking as a healthful form of physical activity began to receive attention in the 1990s due to new recommendations that emphasized moderate intensity physical activity. The main example of moderate intensity physical activity in the 1995 Centers for Disease Control and American College of Sports Medicine recommendation was brisk walking, 3 to 5 miles per hour. Evidence for the health benefits of walking comes largely from epidemiological studies. When interpreting the data from such studies, it is necessary to consider several methodological issues, including the design of the study. Conclusion: walking is a simple health behavior that can reduce rates of chronic disease and ameliorate rising healthcare costs with only a modest increase in the number of activity-related injuries. Keep in mind, walking is rare you're going to injure yourself walking, and compared to like running or jogging or something of that nature. So it's very rare you're going to injure yourself walking. Your risk of joint injuries is going to be low with walking. Now, as I continue, I want to remind people, I'm not a doctor, I'm not a nutritionist, I'm not a cardiologist, I'm not a chiropractor, I'm not a dietitian, I'm not a nutritionist, I'm not an exercise physiologist, not a physical therapist, I'm none of that. I'm not giving health advice. Don't take health advice from people on YouTube. Now, I'll go on with this. This is a Japanese study that shows that walking actually helps reduce mortality in younger elderly, in quotations. So, for men without critical diseases, mortality risk declined linearly with increased walking time after adjustment for co-founders. I think they mean cofactors. Walking over 2 hours a day was significantly associated with lower all-cause mortality. For men with critical diseases, walking 1 to 2 hours per day showed a protective effect on mortality compared with walking under half an hour a day. After adjustment for co-founders, walking over 2 hours a day showed no benefit on mortality in men with critical diseases. Now take note, over 2 hours a day. This might be why you want to do something like a little bit more vigorous exercise, such as using a Nordic track or skiing machine, something of that nature. Conclusion: different duration of daily walking was associated with decreased mortality for younger elderly men with or without critical diseases, independent of demographic and lifestyle factors, BMI, medical status, disease history, and functional capacity, meaning that walking helps you live longer, essentially. Incorporating regular walking into daily lives of younger elderly men may improve longevity and successful aging. Being that I'm into karate, being that I taught karate, being that I took karate longer than I taught karate, but what's important to understand is that in karate we utilize a lot of traditional calisthenic type exercises. Pilates is very similar to traditional calisthenics, like the calisthenics that's used in the military, which is primarily what we use in karate programs, things like leg raises, various stretches, sit-ups, push-ups, etc. Pilates is very similar to that. So this says, can Pilates program be effective on balance, flexibility, and muscle endurance? A randomized controlled study. Okay, so the results. Now these are all linked, remember that. 23 subjects in Pilates group, blah, 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 blah. Conclusions: an 8-week Pilates training program has been found to have beneficial effect on static balance, flexibility, abdominal muscle endurance, abdominal and lumbar muscle activity, and these parameters have no effect on balance. But it does strengthen the muscles of the body, okay? You have to keep that into consideration, and that'll come up later in another study. So this one, they investigated the response of adult novice practitioners to an 8-week traditional mat Pilates program. Classes consisted primarily of beginner and intermediate level exercises compared to active control group. Improved relative body, okay, so they did improve relative body fat, sit and reach, blah, 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 blah. Baseline differences were noted only for the curl up, which is British English for sit up, and low back extensions, which are like Superman's. Pilates lowered body composition, muscular endurance, and flexibility significantly improved after 8 weeks of traditional mat Pilates. So remember that. Body composition, muscular endurance, and flexibility all significantly improved after 8 weeks of traditional mat Pilates. Now the question is, do you need an aggressive bodybuilding program to help prevent issues as you get older? No, you need a consistent program of physical activity that stretches, strengthens, and works the cardiovascular system. Walking, yoga, Pilates, and calisthenics will probably be just fine. So these were 50 sedentary, apparently healthy females aged 60 and older were randomly assigned to a control group or a Pilates group. Results: 8 weeks of mat Pilates. Blah, blah. Conclusion: an 8-week mat Pilates exercise program may contradict, meaning reverse, or even, may contradict, meaning be the opposite of, or even reverse some of the most serious consequences of aging. Contradict is a bad choice of words there, but it might reverse some of the most serious consequences of aging associated with increased fat mass and reduced lean body mass in elderly females, meaning it will reverse fat mass and improve or increase lean body mass in elderly females. In karate, particularly in the Korean forms of karate like Tang Soo Do, Taekwondo, Hapkido, Taekyon, Subakdo, etc., we're very preoccupied with stretching. The reason why is a lot of our techniques, particularly like the more acrobatic techniques and aerial kick techniques and things like that, require amazing amounts of flexibility. However, as people get older and fatter, which they don't have to if they remain physically active, but as they get older and fatter, their bodies tend to not be able to continue to act the way that they did when they were younger. So, stretching obviously is not the most exciting part of a physical activity program, but it's very underappreciated. Stretching does boost flexibility, okay? So these are 21 of the best stretches. So this is to stretch the hamstring. This is just a forward reach or a forward bend. This is the twist. It's the piriformis stretch. The piriformis muscle is a deep internal hip rotator located on the outside of the butt, or it should say the buttocks or the whatever. I don't know why they use that. Its primary role is external rotation. Deep internal rotators, sit on the floor. So this is going over some of these. Lunge with spinal twist. I just wanted to go over these real quick. Obviously, this will be linked in the description. Tricep stretch. That's the thing, too. All of your muscles need to be stretched. People don't understand this. This is why I do prefer to do a bodybuilding type exercise program with light weights. And the reason why is all of your muscles need to be stretched and all of your muscles need to be strengthened. You don't want to negate any single muscle group. Okay, whether it's stretching or strengthening. So this is a tricep stretch. This is stretching the triceps. A lot of people don't stretch their upper bodies like they should. Okay, this is the figure 4 stretch. 90-90 stretch. Frog stretch. I'm waiting for the butterfly stretch is a common stretch. This is the butterfly stretch. It's a common stretch used in martial arts. It helps with side kicks and things of that nature because it stretches the groin muscle. Sit tall, hold on to ankles if you're tight, Okay, seated shoulder squeeze. The shoulder squeeze actually helps open the chest. Side bends. Some of these I would perform a little or a lot different than these. Lying pectoral stretch. Knees to chest stretch. Seated back release. Lying quad stretch. That's another thing that you have to take into consideration too. A lot of these stretches, some of these are performed standing up and some of them are performed lying down. If a person has issues with balance, you can perform these stretching exercises on the floor like this. A lot of people don't know that, and it keeps people from practicing proper stretching, which will help with the release of tension and things like that. The Sphinx pose. Pretzel stretch. Some of the names of these are not what I remember from when I went to school. Standing quad stretch. So this is the standing quad stretch. See, that's what I mean. If you lack balance, you can either hold on to a wall for support, or you could just do it lying down. It's going to stretch the same muscles. That's a double knees to chest. It's not necessary. In fact, I like doing everything singularly. Like when I do calf pumps are basically unweighted calf raises. I like to do my calf pumps separately each leg. Although calf pumps won't be mentioned in here because they're not really a stretch. That's enough of this. I'm going to move on. So this is about home-based breathing exercises in subjects with COPD, but why I'm covering this is this helps to promote pulmonary function. People might be familiar with after surgery, they'll give people spirometers, which is a thing that you breathe in and it helps to train the diaphragm in inhaling. There's also ones where you exhale through the thing. Both inhalation and exhalation are important at retraining the diaphragm, and actually I'm going to get into that in a later video about why I supplement with branched chain amino acids, because it was found supplementing with branched chain amino acids while doing diaphragm exercises obviously works better because it helps to increase the muscle of the diaphragm. So the conclusion, as an alternative method, home-based pulmonary rehabilitation programs, breathing exercises can improve pulmonary function, respiratory muscle strength, exercise capacity, dyspnea, Health-related quality of life in patients with COPD. It's going to improve the quality of life in people without COPD also. It's just they did it with people with COPD. But breathing exercises are important for pulmonary capacity. And I'm going to get into that when I do a later video. But the whole point is to combat aging. To combat the disease state of aging, you need to take an active approach to doing what needs to be done to reverse it. And some of these other disease states, which are caused by what would be called different forms of senescence and or hypersenescence or premature senescence in different systems of the body, you need to do these things now before these things become a problem. This is about gastroesophageal reflux disease and using diaphragmatic breathing, training the diaphragm, and how this reduces the issues with GERD. Again, linked in the description. You can, you can check it out yourself. This study shows that actively training the diaphragm by breathing exercises can improve GERD, gastroesophageal reflux disease, as assessed by the non-pharmacological lifestyle intervention could help to reduce the disease burden of GERD. Now, mind you, that's important because a lot of the medications prescribed for GERD can negatively impact the kidneys. Modified inspiratory muscle training, meaning like the use of a spirometer, as promising treatment for gastroesophageal reflux disease. 19 patients, blah, blah, blah. It's low cost, without side effects. It could be useful in a... So, yeah. And that's all for this video. Actually, I decided that's not all for this video. I wanted to talk briefly. What I want to point out is people need to understand that exercise does not have to be constantly punishing. You don't have to be killing yourself with exercise. You don't have to be injuring yourself with exercise. But you do have to be consistent with exercise if you want results. And that's all for this video.